Hi, everyone. This is Sean, MassSupport Network, here with the Massachusetts Public Health Report for Friday, March 12th, 2021. Well, cases are declining very slightly. We are still, call this a plateau, fewer than 2,000 fewer active cases estimated in the Commonwealth this week. When we look at the number of people under quarantine or monitoring for suspected cases or following exposure, we're a little over 10,000 last week, and we're a little over 10,000 this week, in fact, slightly higher. This may be as a slight uptick here, maybe have slightly more cases next week. We may also see fewer people under monitoring and quarantine going forward as a recent change in travel guidance means that Massachusetts travelers who've been vaccinated don't have to quarantine, so that maybe fewer people who will quarantine just as a procedural thing rather than following exposure. Looking at cases under isolation, there were just over 28,000 people in isolation for confirmed cases of COVID-19, and now it's down to just over 26,000. So a decrease there, but not a lot, not the precipitous declines we were seeing earlier in the year. When we look at hospitalizations, though, that is actually the average age of hospitalizations has dropped by 5 years in the last week. That's a huge decline there. It just kind of shows that it's not that older population that has been getting the vaccine more is much less likely to be hospitalized now. This is actually first time, below 65, everyone 65 plus is eligible for the vaccine. So that kind of shows why the average is falling below there. Deaths remain the same at 77, and the new case average is about 36 right now. 36 years old is the average new case. When we look at the hospitalizations, trends are not as good here. There is some general decline in hospitalizations, about 60 fewer people, but slight upticks in ICU and intubations. Now, of course, as the numbers have gotten much smaller than where they were even 2 months ago, then it is possible that there can just be some upticks just based on when you look at the data or just luck of the draw. It can also be that because there is more resources available, because there's fewer people in the ICU and fewer people on ventilators, there can be times when they may be able to put a case that's kind of on the borderline into intensive care they wouldn't otherwise be able to if they had to save the beds. That's just kind of speculation there. But I would generally say that rises in intubations and ICUs are generally going to follow increases in hospitalizations if they're really part of a trend, and hopefully should drop off again next week. Testing is also creeping back up, just over a day and a half right now, turnaround time from getting a test to having it reported to the Department of Public Health. That's not a huge increase from last week, but it has been increasing for the last 2 weeks now, so that's something to be aware of. Look at our contact tracing. It is more or less staying the same with, in the last 2 weeks, just over 87% of the case outreach completed. Now, we're never going to get 100% on this because some people you just can't reach. That said, the amount completed within 1 day has steadily increased. So that's up to 89% of case outreach is completed in the first day. So that is very promising. The faster that happens, that can also make up for slower actual testing time. But again, I wouldn't expect our numbers to get, our percentages at least, to get much higher than they are right now, just because of the realities of contact tracing. When we look at the state as a whole, the average daily incidence rate, which is the number of new cases per 100,000 people per day over the last 2 weeks, went down by 1. It was 21.3 last week. It's 20.3 this week. And there's generally been slight declines across the state. However, not everywhere. A lot of the smaller counties did see some increases. Barnstable, Dukes, and Franklin all saw slight increases. Most everywhere else saw slight declines, but some of these are as small as a 1/10 of a case per day. Worcester went from 20.3 last week to 20.4 this week, for example. So by and large, things are pretty plateaued right now. When we look at the positivity, that's the number of COVID-19 tests that are coming back positive. The average last week was 1.8% of tests were positive. So it's down 0.1%. That's largely due to the higher education screening testing, which of course lowers the general average, coming down from 0.3% to 0.2%. Without that taken into effect, the state average has remained 3% of COVID-19 tests are coming back positive these days, which is still pretty good, honestly. If you compare to how things were, last fall, that's, before the surges, that's kind of where we're talking about trying to keep below that point. But again, we would like to see how things come down even further, of course. As we look at the 7-day average since the beginning of February, you can see things haven't really changed much in the almost the last entire month. After this last decline in mid-February, it brought us down to about 1,500 cases per day. We have stayed roughly there for several, almost several weeks at this point. And that's kind of a tough place to be stuck if we can't make any more progress in pushing these down. And that's the thing is with something like COVID-19 is more cases lead to more cases and fewer cases lead to fewer cases. So we kind of have to get some motion going in order to prevent, this thing from kicking back up. One last thought as we go out to the weekend, MassSupport did a really excellent town hall on vaccinations and vaccines last night, coming to a YouTube channel near you very shortly. So keep an eye out for that, for a lot of really interesting stuff on vaccinations, rollout, variants, etc. You will learn quite a lot. I know I did. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands. We'll be there if you need us. Stay safe.